at a different stage of the pandemic right now than we were at the start of the second wave or even the first wave. And in terms of, contact tracing, I guess how else are you looking to improve it other than the swift responses? I guess, would you sort of err on the side of caution and shut down a business or facility suspected of maybe potentially being an exposure site and going to secondary and tertiary contact much sooner?
In a sense, that's happening. So there are new workplace obligations in the public health directions that mean that people who are suspected of having coronavirus, so just symptomatic essentially, there is an OC health and safety obligation on the employer to make sure that they're not attending that site. So in effect, that's managing a suspected case. I wouldn't go so far as to shut down every place that has someone with a runny nose or a cough. That would be excessive and disproportionate. But there are obligations to make sure that symptomatic people aren't in the workplace, and that's really important, both from an employer and an employee point of view. When we're listing exposure sites and saying people who are casual contacts, in a way that's also going to contacts of contacts, if you like. Some people who might normally not be considered close contacts, just casual contacts, are contacts of contacts. Their other family members might be the close contacts. They are not close contacts, but we're telling everyone to test. We're asking those symptomatic people to isolate as well.
You've consistently said that part of, you look at the case numbers obviously, but you also look at the story behind the data and the story behind the case numbers. What has it revealed about transmission and also about the pandemic in Victoria in the last week or two?
Look, I think I've alluded to it. It's really that the individual cases that we're seeing now at a community level have enormous complexity to them. It is a reflection of the socio-demographic features of those communities. There are really difficult circumstances that people are in. There are networks and connections that people have across workplaces and households that have enormous complexity, and there are really significant supports to enable people to test, to isolate, to quarantine that we need to step in with and that we need to understand at a local level. And the local public health units are a really critical part of that transition, understanding what the barriers and enablers are to help people do what they need to do and to make sure that all of the information that is required to manage those really complex circumstances are investigated and understood.